Hi, I'm Adel and welcome to this series of videos. These videos are part of your consent process, which includes the consultation with me, the written information I gave you in the clinic, and the letters in the post. These videos are generic and an aide-de-memoire, so feel free to watch them as many times as you like, jot down any questions you have, and I'll go through them with you in the clinic at our next appointment. If you're not one of my patients, these videos do not constitute independent medical advice and shouldn't really be used outside of the context of a consultation with me. Either way, I hope you find these videos interesting and informative. Rhinoplasty surgery is day case procedure surgery. When you wake up, you should be comfortable without any pain, but you'll have the sensation of a blocked nose. Lots of anaesthetic is used in the nose to try and numb it, to make sure you're comfortable when you wake up. Within hours you may see bruising around the eyes, and this is quite normal. You'll also have a drip pad under the nose to catch any drips of blood for the first few hours after surgery. Sometimes you need to wear it for the first night too. The tip of the nose will begin to swell, and you'll have a splint on the outside of the nose. This is to control the swelling of the soft tissues and to hold any bones in position that may have been moved. The splint is removed at 1 week, as well as any external sutures on the columella of the nose, this bit here. Once the splint is removed, you may find the nose begins to swell again. Don't be alarmed, this will settle over time. You'll find that the majority of swelling will have settled within about 6 weeks, and then the remaining swelling will take around about a year to go. Often it's said that your final result is a year down the line. You should be thinking long term in terms of your rhinoplasty result, but also I've noticed over many years rhinoplasty results continue to change slowly with the aging process. So once you've had your nose job, your nose won't remain magically younger or unchanged as the rest of you ages. After the surgery, you'll need to take about 2 weeks off work to hide the bruising and to give yourself a chance to recover. In the first week or so, I suggest you sleep upright, propped up on a few pillows. This stops the blood rushing to your head and the swelling around the nasal area increasing. It's a good way of preventing swelling and keeping what swelling you have under control. Ice packs can also be used in the early post-operative period to try and keep the swelling down to a minimum. Ice packs may also help with the bruising around the eyes. After your surgery, I suggest you don't bend forward, reach up, strain or carry heavy shopping. All of these will put the blood pressure up and may cause a small nosebleed. In addition to this, you shouldn't blow your nose if possible. It sounds difficult, however you'll be given ointment to put inside your nose. This will soften any crusts that form, which can easily be removed with the tissue. Common things that occur after a rhinoplasty. One of the most common things is the swelling of the nose. People notice this and become quite alarmed. It's quite normal for the nose to swell up more after the surgery, especially if the splint is removed. And over the first few weeks, a lot of this swelling will settle down. The tip of the nose is usually the last place for the swelling to go, and depending how thick the skin is, the thicker the skin, the greater the amount of swelling around the tip of the nose. Sometimes it takes a year or so for this to settle, sometimes longer. You'll have the sensation of a blocked nose. The nose not only swells on the outside, but also on the inside, and this will take maybe 1 or 2 weeks to settle down. You may feel slight lumps or bumps under the skin, and these shouldn't be particularly visible. These are normal and to be expected. Bruising around the eyes and on the cheeks usually takes a couple of weeks to go. Sometimes it's more severe. Again, it will resolve over time. Whether it is an open or a closed rhinoplasty, you'll notice some temporary numbness of the nose. The nerves that supply the sensation to the skin will have been severed during the procedure or stretched during the procedure, and will take some time for them to come back. The tip of the nose is the last point where the sensation is returned. Most patients a few months down the line will still say they have a small numb area here, which does resolve over time. You may have temporary taste and smell changes, and this is quite normal because of the blocked nose. Rarely this can occur long term, and we're not quite sure of the mechanism, but maybe something to do with the nerve supply to the lining of the nose. You may get watering of the eyes after surgery. Swelling around the area of the bone cuts may cause the tear ducts to become quite engorged, and the tears will spill over. This usually resolves within a couple of weeks. Actually cutting the tear ducts accidentally is very difficult and unlikely to occur, but theoretically could be a possibility. Common complications following rhinoplasty surgery. These minor things may occur following surgery and are part of the risks undertaken as part of the procedure. So a nosebleed may occur, and we'll be giving you advice about how to deal with a nosebleed at home, and of course, should it be significant, you'd be asked to come to the hospital to be reviewed. A septal haematoma is blood collecting underneath the lining of the nose in the septum, the plate of cartilage that divides the two nostrils from each other. A septal haematoma can occur, and we look for it at the first post-operative consultation. If it is there, we will insert a small device to drain the haematoma and maybe place a nasal pack. If it's very small, we'll simply leave it alone. Infection risk is low in rhinoplasty surgery. I would estimate it at around about 2% or possibly up to 5%. Persistent long-term swelling is more of an issue, especially in thicker skinned individuals. This can take some time to settle down and may require massage or other exercises to try and control the swelling. Minor airflow changes may occur because the anatomy of the nose has been changed. Usually these are temporary, but they can be permanent. In rare cases, there can be adhesions between the side wall of the nose and the centre. They are called synechiae. They may require further surgery to divide and a splint placed to prevent them from reforming. They are difficult to deal with. Serious complications of rhinoplasty surgery. These include significant bleeding, either on the table during the procedure or after the procedure. This may require nasal packing or return to theatre to deal with. Sometimes additional scars are required on the outside of the skin. These may be to introduce small instruments through the skin near the eyes in order to help the bones move, to cut the bones. Very rarely you may get an instrument coming through from the inside through very thin-skinned individuals. This is rare but could occur and therefore leave a visible scar, and for this reason I think it's important you should know about it. Open roof deformity is when a hump has been taken down but the roof of the nose, this bridge area, is left open such that the lining of the nose comes into contact with the skin on the inside. This can cause pain or discomfort upon inhaling cold air or wearing spectacles. In many rhinoplasty surgeries we are required to cut the bones, and fractures can occur, sometimes in an unpredictable fashion. In the worst case scenario, a fracture could extend up into the skull base and cause a brain fluid leak or CSF leak. This is incredibly rare, but should it occur, then you'd be admitted and kept on IV antibiotics through a drip until the leak seals itself, which is the most common outcome. The reason you'll be admitted is because of the risk of meningitis. The symptoms you may experience following rhinoplasty, if this did occur, would include a severe headache and clear fluid dripping from the nose. Very rarely nasal packs inside the nose are used to support the nose or prevent septal haematoma from forming. I don't generally use them very often, but they may be required. Nasal packs left in situ inside the nose may predispose to toxic shock syndrome, and for this reason, should you be given a nasal pack, then you'll be given antibiotics to cover this to reduce the risk of toxic shock syndrome. Toxic shock syndrome is a very severe form of sepsis that may result in intensive care admission. In patients with sinusitis or typical sinus problems, I usually tell them to expect a bout of sinusitis following rhinoplasty surgery. Following surgery to the nose, sometimes changes can occur to the lining of the nose, causing very dry crusting inside the nose. This is called atrophic rhinitis. Conversely, you may get the opposite, where you get a very runny nose or hay fever or allergy type symptoms, and this is called vasomotor rhinitis. Sometimes you may get very slow healing to the incisions or crusting or problems with the wound. This may require further surgery. Septal perforation may occur. This can occur with tears to the lining between the two sides of the nose, or haematomas forming on both sides, causing damage to the cartilage of the nose. Damage to the cartilage of the nose may end up with something called saddle nose deformity, which would be a very disfiguring and obvious deformity if it occurred. this definitely requires formal reconstructive rhinoplasty in order to correct or improve its appearance. Some of the very serious complications are very frightening, but are incredibly uncommon. The most common complications of all are those to do with the appearance of the nose and the patient's perception of the appearance of the nose. It's estimated around about 10% or more patients require touch-up procedures to make them happy. Typical things include differences between the two sides of the nose, the patient feeling that the nose has been under-corrected or over-corrected, or simply being unhappy with a technically good result. And that's why it's so important to spend a lot of time with each other, ideally working out exactly what you want to achieve and the reasons behind this in order to see whether the plan and goals that you want are achievable by surgery alone. In the current age where we're always taking photos of one another, it's incredibly important to point out that the nose will not look perfect at every angle at every time. In certain lightings or certain positions, you'll notice perhaps slight divots or contour irregularities in the nose that are not visible in normal day-to-day contact. This is quite normal and something that you should expect. The nose cannot look perfect at every angle every time, and for this reason surgery will not achieve that for you. Rhinoplasty surgery is complex and what we describe as being goal-oriented surgery. In other words, many different techniques can achieve the same result. Sometimes we'll discuss the techniques before the day of surgery, but on the day of surgery we may find that the appearances inside the nose may not be suitable for such techniques, in which case different techniques may be used. This may differ from our recorded plan in the preoperative consultation, but is performed in your best interest in order to achieve the goal that you want. In other words, we're trying to get the result that you want rather than using the technique that we described beforehand. Patients who are worried about the appearance of the nose may be asked to have a psychological consultation. This isn't because I think you're crazy, this is because I think it's really important to treat the patient as a whole and not simply as a surgical procedure. As I'm not trained as a psychologist, I sometimes can't work out why patients particularly want surgery on their nose. In addition to this, it's sometimes important to try and work out whether, if surgery doesn't meet goals, whether patient's psychological condition will be worsened and they'll be left worse off than if they'd not have the surgery. So the two things I'm usually looking for in a psychological evaluation is, will the rhinoplasty surgery actually be of benefit to you? And if it went wrong, do you have the resilience to deal with the fallout? It's all part of the holistic care to ensure you get the best outcome from your surgery.